Today we're going to have a real, honest, and yes, sometimes surprising conversation about prostate cancer. Hello, I'm Dr. Zaid Fadul, and I'm board certified in family medicine and addiction medicine with nearly 2 decades of experience treating patients in hospitals, clinics, community health centers, addiction facilities, and as a physician in the United States Air Force. If you're a man over 40, follow along for a roadmap and the tools to protect yourself from prostate cancer. We'll break this down into bite-sized sections so you leave with knowledge, a few laughs, and maybe even the urge to share this with a friend. Prostate cancer is the most common cancer in men in the United States and the second most common cancer in men worldwide. In the US alone, about 1 in 8 men will be diagnosed with prostate cancer at some point in their lives. That's more common than forgetting your wedding anniversary, though trust me, both can have serious consequences. Before we dive into cancer, let's talk about the prostate itself. The prostate is a small, walnut-sized gland that sits below your bladder and in front of your rectum. Its main job, just like the Navy, is to help make semen. So yes, it's small, but it's mighty, and when it goes rogue, it can cause big problems. Prostate cancer can happen when cells in the prostate start to grow uncontrollably. Most of the time, this growth is slow, so slow in fact that many men will never even know they have it. Sometimes it can be aggressive and spread really quickly. Here's the kicker. At autopsy, up to 70% of men in their 70s have some form of prostate cancer, but most never know it. It's the ultimate stealth mode. There are 5 main risk factors. Number 1 is age. Risk rises sharply after age 50. If you're over 65, you're in the hot zone. Ethnicity. African American men are at higher risk and tend to get more aggressive disease, while Asian men have lower rates. Family history. If your dad or brother had prostate cancer, your risk doubles. Diet and lifestyle. High-fat diets, obesity, and lack of veggies may play a role, but the science here is still evolving. Genetics. Certain inherited mutations like the BRCA2 gene can increase your risk. So, if you're a chubby, sedentary man over 65, especially with a family history, congratulations. You've just hit the prostate cancer risk bingo. Here's the tricky part. Early prostate cancer usually has no symptoms. When it does cause problems, you might notice one of the next several symptoms. Are you having a hard time starting or stopping your urine? Maybe your urine stream is weak, or you feel like your bladder isn't empty after you go. You might also need to urinate more often, especially at night. These changes can be early warning signs of prostate cancer. If you feel pain or burning sensation when you pee or during ejaculation, don't ignore it. While other conditions can cause this, it's still a symptom you should get checked out. Seeing blood in your urine or semen is never normal. Your urine might look pink, red, or even cola colored. This is a serious symptom that needs a doctor's attention right away. Are you suddenly having trouble getting or keeping an erection? New or worsening erectile dysfunction can sometimes be related to prostate cancer, so it's important to talk to your doctor if this is happening to you. If you're experiencing pain in your lower back, hips, pelvis, or upper thighs, and you can't figure out why, this could be a sign that prostate cancer has spread. Don't ignore ongoing pain or discomfort in these areas. But these symptoms can also be caused by non-cancerous conditions. So don't panic, but don't ignore them either. Screening usually involves a blood test that measures your prostate-specific antigen, or PSA, and sometimes a digital rectal exam, or DRE. The PSA test isn't perfect. It can be high for reasons other than cancer, like an enlarged prostate or infection. And yes, the DRE is exactly what it sounds like. Not fun, and you aren't mentioning it to your wife either. Screening is controversial because it can lead to overdiagnosis, finding cancers that would never cause harm, but it can also catch aggressive cancers early when they're most treatable. That's why shared decision-making with your doctor is key. In training, my program director quipped that all men will get prostate cancer if they live long enough. With our focus on longevity medicine and extending lifespan, screening and monitoring is more important than ever. If your PSA is high or your DRE is abnormal, your doctor may recommend a prostate biopsy, meaning that we take a small sample of the prostate and look at it under a microscope. This is the only way to know for sure if you have cancer. Sometimes imaging like MRI is used to guide the biopsy and find suspicious areas. Biopsies aren't fun, but they're usually quick and done with local anesthesia. Most men go home the same day. Once diagnosed, we use a combination of tools to stage the cancer. A Gleason score tells us how aggressive the cancer cells look under the microscope. We stage from 6 to 10, with 6 being non-concerning and 9 or 10 being highly aggressive. For PSA, higher numbers can mean more advanced cancer. Normal is considered 1 to 3, but the rate of elevation also matters. MRI, CT, or bone scans may be used to see if cancer has spread throughout your body. We then group cancers into risk categories: low, intermediate, or high risk. This helps tailor your treatment because not every cancer needs to be treated the same way. Treatment options from watchful waiting to warrior mode. Here's where things get interesting and hopeful. Treatment depends on your risk category, age, and preference. For low-risk cancers, we may just monitor you closely. No treatment unless things change. We call this active surveillance. For high-risk cancers or younger men, surgery or radiation can be curative. Hormone therapy can slow down or stop cancer growth by blocking testosterone. For aggressive or metastatic cancers, options include chemotherapy, immunotherapy, and targeted drugs. A surprising fact is that many men with low-risk prostate cancer never need treatment and have long and healthy lives. Let's be real, treatment can have side effects. Urinary incontinence, erectile dysfunction, bowel problems. But not everyone gets these, and many side effects can be managed. Newer techniques are reducing risks all the time. The key is to discuss your priorities and concerns with your doctor. This means regular PSA tests, DRE exams, and occasional biopsies or MRIs. The goal? Avoiding unnecessary treatment and side effects while still catching any changes early. It's like having a security system for your prostate, always on guard, but not overreacting to every squirrel in the yard. Here's the bottom line. Prostate cancer is common, but most men do very well, especially when it's caught early. The 5-year survival rate for localized prostate cancer is nearly 100%. Even for advanced cases, new treatments are improving outcomes every single year. What can you do? Talk to your doctor about your risk and whether screening is right for you. Stay active, eat a balanced diet, and don't ignore symptoms. If you're diagnosed, take your time, ask questions, and make decisions that fit your values and lifestyle. And remember, you aren't doing this for you, but for your loved ones. Invest in your health now so you can outlive your wife later. Share this video with someone who needs to hear it. Leave a comment below with your experiences or questions, and subscribe to stay informed. An ounce of prevention is worth a pound of cure. Thanks for watching.